this 4:30.
Good afternoon to all. Today I am going to present my study on late probing of our congenital nasolacrimal duct obstruction. Forward. Author has no financial interest to disclose. Congenital nasolacrimal duct obstruction is a common abnormality in infants, affecting up to 20% of infants. It presents with watering and discharge starting few days after birth, and site of obstruction is usually at inferior portion of the nasolacrimal duct. Management of CNLD obstruction includes lacrimal sac massage, which has a very high 90% success rate, and then NLD probing. It is done usually at 1 year of age under general anesthesia, and cure rate is about 90%. Some prefer early probing at 6 to 7 months of age under topical anesthesia. However, the success rate for late probing is variable, and the patient who don't respond to sac massage or probing, they are subjected to dacrocystorhinostomy. The purpose of this study was to evaluate the outcome of nasolacrimal duct probing between 2 years and 5 years of age. It was a retrospective study, and medical record of patient who underwent probing between January 2011 and December 16 were studied. Inclusion criteria was initial probing between 2 and 5 years of age, performed by a single surgeon using single technique, and minimal follow-up of 1 month. Exclusion criteria were history of acute dacrocystitis, punctal or canaliculi abnormality, history of probing in the past, and follow-up less than 1 month. Uniform technique was applied under general anesthesia. Upper puncta was dilated with punctum dilator, and procedure was carried out with Bowman lacrimal probe. Coming to result, there were total 257 procedures performed during this study period, and 132 were between 2 years and 5 years. After applying the exclusion and inclusion criteria, 49 procedures of 41 children were eligible for the analysis. It was unilateral in 80% of cases, and 39% were male and 61 female. Mean age at the time of probing was 36 months, and mean follow-up was 32 months. The cure was defined as a resolution of watering and discharge within 1 month of the probing. The cure rate in our study was 75.5%, and failure was 24.5%. Out of the 12 patients who failed, in 4 cases probe was passed easily, and they were referred for repeat probing with intubation. And 8 cases there was bony obstruction and probe could not be passed, and they were referred for dacrocystorhinostomy. Probing is the standard treatment for congenital nasolacrimal duct obstruction if doesn't improve with the lacrimal sac massage. However, the cure rate in probing is usually done at 1 year of age, and success rate is around 90%. But the cure rate in older children is variable. Wells and Kotovich presented that the success rate decreases by the increasing age, and they believe that by increasing age there is a chronic infection and fibrosis that decreases the success rate. However, the Paul and Seffert have different opinion. They believe that it is self-selection process, means the simpler cases they get cured by the time, and only complex cases have remained, hence decreasing the rate of success. Several investigators have studied the result of probing in older children and have variable results, like Stroke and colleague found success in 42% of cases, Young and Associate 54%, Koskoli in 72%. In our study it was 75%, slightly higher than other studies. Therefore, we conclude that late initial probing between 2 years and 5 years is effective with good cure rate, and probing should be attempted in older children also prior to going for complex procedure like DCR. Thank you very much.
Your follow-up was quite long, I think, about whatever, and your success rate you defined at 1 month. That's very short time, I think.
Sir, we took at 1 month, like first follow-up. After 1 month, if a symptom may resolve, then we took at this success rate.
Objective, and then 1 month is very short time. Even healing doesn't take place. So I mean, results could be at least 3 months, 6 months follow-up probably would be desirable.
And now how many cases and how many times you did re-probing?
Sir, it was initial probing, sir, and
You know, how many times you, in the cases, 8 cases which you showed they failed,
yes, sir.
in that did you do re-probing?
4 cases, sir. 4 cases were referred for in oculoplasty department for repeat probing and intubation, and 8 cases for DCR.
And what was the
Inclusion criteria was mainly initial probing between age of 2 and 5 years. It was initial probing.
What were the causes of bony obstruction? You mentioned that in certain cases there was a bony obstruction. What was that?
So there was a development problem in nasolacrimal duct, bony nasolacrimal duct canal.
Bony?
Bony canals.
Do they have similar follow-up, or they are having different follow-ups? Because it could be that you did 1 month follow-up, they might have taken longer follow-up. So do we have some kind of symmetry there, or it is very variable?
Sir, most of the studies they take 1 month, because if symptom is resolved and doesn't recur within 1 month, usually they remain same. Thank you, sir.